Today we're going to review the Kennedy Class 3 cast that you did as an exam last week. The first thing that you want to do is eyeball the cast. Take a good look at it. Think about the Kennedy Class 3 rules. Place your fulcrums where they belong and decide where you think the clasp assemblies will be placed. Decide where all the rest would fall if you place those clasp assemblies and that they fit the rules. Then decide on the type of tooth replacement mechanism for the various edentulous areas. That's a starting point. Basically, we have these three possible fulcrum lines shown on the cast. You have to prevent rotation around two of these fulcrum lines by placement of direct retainers in front of the selected anterior fulcrum line and behind the posterior fulcrum line. You could go to the most anterior fulcrum line and place direct retainers on the mesiofacial of number 22 and 27, but that would not be very aesthetic, especially when you have a fulcrum line through the second premolars that you can use. We can prevent rotation by placing direct retainers on the second premolars, and that would be more aesthetic for the patient. The retentive tips of the direct retainers preferably are separated as much as possible from each other. So the preferred placement is on the mesial buccal of the second premolars and the distofacial or distolingual of the two molars. The question is whether there are undercuts in these positions or whether undercuts can be made through modification. So we're going to try to use the second premolars and the molars as our primary abutments, but we might use the canine at the anterior of our edentulous area on the patient as another possible abutment for our second premolar if it doesn't work out. We usually clasp the teeth next to the posterior edentulous areas as abutments for our Kennedy Class 3 when we have a peer abutment like what is seen with number 20. We place the cast on the surveyor. Place it in a position with the occlusal plane relatively parallel to the floor and where the guide planes on each abutment tooth near the edentulous areas have approximately equal undercuts. This means that we will have the least amount of modification on each abutment tooth to create at least a 2 mm guide plane area on each proximal surface of the abutment teeth. This is a starting point. We may have to alter our cast position slightly to get the desired undercuts, but retention takes precedence over guiding planes. We will place 4 direct retainers on the Kennedy Class 3 or 4. More is overkill. We're going to work with the 2 fulcrum lines shown on the slide. We're going to place direct retainers in front of the anterior fulcrum line and behind the posterior fulcrum line if possible. Let's look at the fulcrum line through the second molars to our edentulous areas. I have arrows in the positions where I have 0.01 undercuts. Our clasp of choice for the Kennedy Class 3 and 4 is the cast circumferential clasp. Ideally, we would like to use the cast circumferential clasp called the simple circlet clasp, which would call for a rest on the mesial next to the edentulous area with a direct retainer going to the distolingual or distobuccal 0.01 undercut and the reciprocal component on the opposite side of the tooth at the distal. The simple circlet has less metal and uses less rest. It uncomplicates the seating of the framework and preparations. Another choice for the posterior molars is the mandibular ring clasp. It has a mesial rest, a reciprocal component leading to a distal rest, and then the direct retainer arm originates from the distal rest and goes into either a mesiofacial or a mesiolingual 0.01 undercut. Which is the best choice? It depends on your survey lines on the tooth and what modifications can be made to the tooth without getting into dentin or mutilating the tooth. Here are some things to remember with clasp decision. The mandibular molars tend to lean to the lingual and to the mesial, so the undercuts are going to be very strong on the lingual aspect. Remember that the first 1/2 to 2/3 of the direct retainer has to be above the survey line. The terminal 1/3 is ideally in the cervical third, but not higher than the middle third. Also, the entire reciprocal component has to be above the survey line, ideally in about the middle third of the tooth. It cannot be high and interfere with occlusion. With this in mind, we're going to look at the survey lines. This slide shows the labial surfaces of number 18 and 31. The undercut on the buccal, there basically isn't one until you get to really far on the mesial aspect. And to place a direct retainer on these surfaces would not be very effective, and it would be almost into the interproximal area. The survey line will be so low that it is ideal for the reciprocal component, though. The reciprocal component is entirely in the middle third of the tooth, and this one makes it very easy to place it there because the survey line is all the way down at the gingiva. If we wanted to put the reciprocal arm on the lingual, that high survey line makes it very difficult without practically mutilating the tooth in order to get the reciprocal component at the middle third, or even to get it all entirely above the survey line since it's such a high survey line. So we like the direct retainer to be on the lingual and the reciprocal component to be on the buccal. Here you can see the two undercuts on the lingual of the molar. It appears that the undercut is pretty equal on the mesiolingual and on the distolingual. Therefore, on number 18, you would not have to modify the tooth on the mesiolingual any more than on the distolingual in order to place the first 2/3 of the direct retainer above the survey line. So, you can place the simplest circumferential clasp, which has the direct retainer going from the mesial to the distal. You do not have to do more modification on the tooth if you go from the mesial or whether you come from the distal. You can also use a ring clasp on this side, but it would just complicate things as there's more metal and more rest. More metal translates into a higher risk of the framework fitting properly. If I have to put all of the reciprocal component entirely above the survey line, and it should be in the middle third of the tooth, which side of this tooth is better for the reciprocal component? The buccal survey line is down to the gingiva, so I can easily put all of this reciprocal component above the line and keep it out of reach from the occlusion of the opposing arch. I need to place the reciprocal component in the middle of the tooth. I would not have to do severe grinding on the buccal surface of the tooth to do so. The lingual surface of the tooth survey line is shown on the left. I would have to do some very severe grinding on the lingual to bring that survey line down to place a reciprocal component in the middle third of the tooth. So the buccal surface looks good for the reciprocal component. Let's switch to the direct retainer and think. The first 1/2 to 2/3 of the direct retainer must be above the survey line. The lingual surface would need less modification if I use it for the direct retainer, since it originates in the upper 1/3 and then goes apically to the undercut. The survey line is in about the same position all along the lingual surface, so it looks like I would also have the same amount of reduction whether I came from the mesial or from the distal. So I might choose to do the simplest circlet direct retainer on the lingual of tooth number 18. I usually choose the worst undercut on the tooth for placement of my direct retainer terminus. The tip goes into that undercut in the terminal 1/3 to 1/2, so I don't have to adjust the tooth as much and run the risk of getting into dentin. The mesiobuccal surface of these two molars have slight undercuts, but they are almost onto the mesial surface of the teeth. There's not enough room to have the terminal 1/3 of a direct retainer under the survey line for good retention. Having a direct retainer with just a very little tip of the arm under the survey line is not very effective. Number 18 and 31 have no undercuts on the distal buccal surface. The only possibility for direct retainer on this surface would be at the mesial buccal line angle. This buccal surface is ideal, though, for the reciprocal component, which demands that it be placed in the middle 1/3 and be all above survey line. It requires no major modification. You can see that the mesio and distal lingual line angle are shown in number 31. It appears that the undercut is more dramatic on the mesiolingual. Therefore, we will use that surface for the retentive tip of the direct retainer. A ring clasp is the best solution for this type of an area because it starts at the mesial, the reciprocal component is on the buccal surface, another rest is placed on the distal, and the direct retainer arm originates from the distal, comes forward into the 0.01 undercut on the mesial lingual. This would be the best solution for this type of an undercut when you have it at the mesial aspect of the tooth. You often find this on tilted molars that lean to the mesial and to the lingual. Let's try to understand this a little bit better if you're having trouble by looking at the survey lines on number 31. I see that the survey line on the buccal is at the gingival margin and the survey line on the lingual is almost to the occlusal surface with a severe undercut on the mesiolingual. I want to choose the most severe undercut for the placement of my terminal 1/3 of the direct retainer tip so that I have to do as little modification as possible. Therefore, I'm going to choose the mesiolingual for my direct retainer tip. How do I get there? I have to use a ring clasp on number 31 to get to the mesiolingual undercut, approaching it from the distal rest area. If I choose the lingual for the direct retainer that originates from the distal, I only have to alter the distal lingual half of the tooth to place the first half to 2/3 of my clasp for the direct retainer above the survey line, and then I can go below the survey line to place the retentive terminus at the middle third in the 0-1 undercut. This tooth leans way too much to the lingual to try to attempt to get my direct retainer tip down to the cervical third. This would require unbelievable alteration of the tooth. This is the best choice for the placement of my direct retainer. If I wanted to place my reciprocal component on the lingual, I would have to mutilate the entire surface to get the reciprocal component all above the survey line and down to the middle third of the tooth. That's why I'm going to choose the buccal surface for my reciprocal component and the lingual, where the worst undercut is located, for my direct retainer. The mesiolingual surface of tooth number 21 has an area of retention of 0.01 undercut on the mesiolingual. If we use it, it would place the direct retainer in front of the survey line. This is a good thing to prevent rotation. It would also separate retention better than if we used the buccal surface, the distal buccal surface of number 29. Our text does not recommend the use of the lingual surface of the premolars because the arm is often very short on that side, but it is sometimes utilized. Another reason that it is not recommended is that when we do place that arm on the lingual, you have to dip down with your major connector and avoid the marginal gingiva by 3 or 4 millimeters in order to place the arm on the lingual surface. Patients sometimes complain of food packing in those areas where you dip down. If you look on the buccal surface of number 20, the best possibility for placing a direct retainer would be on the distal buccal, but that does not put the direct retainer tip in front of the fulcrum line. You can get an 0-1 undercut on the mesial buccal of that tooth, but look at how dramatically you have to tilt the cast in order to get that to happen. So on this tooth, we have to choose between the mesiolingual of the lingual surface, or we have to choose from the distal buccal of the buccal surface. Our next options would be for number 22 and 27 to have mesiobuccal retention with a cast circumferential clasp coming from the distal into the mesiofacial undercut. Both of these are acceptable solutions, but from an aesthetic standpoint, it's not very aesthetic. So I would probably choose to put them on the two premolars posteriorly to get a little bit better aesthetics, and those would probably be effective enough to prevent rotation around that anterior fulcrum. But there's nothing wrong with the 22-27 mesiofacial because we do have the 0.01 undercuts. It is a solution. The mesiofacial of number 28 and 29 can also be used depending on the tilt of your cast. That's why there's so many varieties of solutions for clasping on this particular cast. But the idea is that you want to have the least amount of tilt on the cast and the least amount of severe modifications of the teeth, and that's the position you want to choose and come up with the positions for your direct retainers. I know that's a lot to think about, but every time you change the tilt of that cast, you have to go back and look at the undercuts on all the other teeth to see what you have changed, as well as the guide planes. But you're trying to find that ultimate best position where you have to modify the teeth the very least. Number 29 also has a good undercut on the mesiolingual. Sometimes when the teeth lean to the lingual, that is the surface we have to choose to get good retention. In this case, we are using lingual retention on our posterior molars, so we've already satisfied balanced retention because we have at least one direct retainer on the lingual on one side of the arch and one direct retainer on the lingual on the opposite side of the arch. The other two can be either surface. We sometimes have three of the four clasps, either on the buccal or on the lingual surface, and the other one on the opposite. There is nothing wrong with three being on the lingual and one on the buccal. There's nothing wrong with having four on the lingual and none on the buccal. Our text indicates that it's best to have them all on the buccal. On the mandibular, that's not always possible. We said a disadvantage, though, of having the direct retainers on the lingual is that you have to dip down the major connector so that you can put an arm on the tooth, and you have to avoid that marginal gingiva by at least 3 millimeters. And the other thing that you have to think about, we have to have a major connector that's at least 5 millimeters wide for strength below that dip down area. So sometimes you have to cut retention in a tooth to get the undercut, and sometimes you have to crown a tooth to create the desired contours when you have problems like this. You do have to avoid perforating into the dentin when you prep an undercut on the tooth, because the patient would be very uncomfortable every time that arm moves and touches the dentin. This picture just shows our surveyed cast with the tripod marks on it, just to remind you to do that. The arrows on the cast that are green show the first option that you cannot use because it goes against the rules of ballast retention. If you use this combination, the partial would want to dislodge itself in the direction of the green arrow. In other words, you would have buccal and lingual retention, buccal on one side, lingual on the other, and that partial would want to dislodge itself. The red arrows show the combination that also cannot be used. If you used buccal on the red side of the cast and lingual on the opposite side of the cast, that partial denture would want to dislodge itself in the direction of the red arrows. So you have to have buccal on opposite sides in order to achieve balanced retention. In this particular case on the class 3, 4 clasps are called for as far as the proper number of clasps. The design shown is one solution to the design for this cast. It shows all 4 direct retainers using lingual retention. Tooth number 18 has the simple circlet direct retainer going from the mesial to the distal on the lingual. The survey line showed equal undercut on the mesiolingual and distal lingual, so simple alteration would be needed in both places. to place the first 1/2 to 2/3 of the direct retainer arm above the survey line. So I chose the simple circlet cast circumferential clasp over the ring clasp. On 20, I chose to use the lingual direct retainer arm into the .01 mesiolingual undercut. Because I did this, I had to dip down the superior border of my major connector and avoid the marginal gingiva by 3 to 4 millimeters, come back up on the mesial, and I placed a rest on number 21. Does this tooth have to have another rest since there's one on the distal? Not necessarily, but it does offer some additional support. We do have to place a rest next to or near every edentulous area. So I also chose to place a disto-incisal angle rest on tooth number 22. This provides support for both one of the posterior and the anterior edentulous areas. Tooth number 24 and 25 need to be replaced, and we just plate lateral incisors. We don't put a rest on them. So we plate that over to the canine, and that distal incisal angle rest gives us support for those two missing teeth in the anterior. When you do dip down on the lingual of your major connector, you have to avoid the marginal gingiva by 3 to 4 millimeters. Otherwise, you're going to have a food trap in that area. Here we show the option where the distofacial .01 undercut of tooth number 20 was engaged for retention. The lingual retainer arm was also used as a choice, and it would place the direct retainer tip anterior to the fulcrum line. Number 20 is also an option for retention, as the tooth definitely has a large undercut and a high survey line on that distofacial. The reciprocal component on the lingual would be very high on the tooth, and the lingual plate would best be placed in the middle 1/3 of the for the reciprocal component. So you would have to draw the plating on the middle third of number 20, which would place it below the survey line, and then you would show with a red circle that you're going to modify the tooth on the lingual in order to bring the survey line down below your lingual plating. The best option on this side would possibly be to go to the canine mesiofacial and use then that in conjunction with the molar distal lingual. This separates retention as much as possible and places the direct retainer tips posterior to the posterior fulcrum line and anterior to the anterior fulcrum line. One problem of going from the mesial to the distal, as on 29, with the retentive arm, is that a lot of metal shows, because you would see it from the facial when you're looking in the patient's mouth. We do not use this on maxillary premolars because of aesthetics. A third option is to place your direct retainer on the mesial facial of the canine. This placement is probably the best from a mechanical perspective, as it separates retention the best and it places retention close to the anterior fulcrum line. But from a standpoint of aesthetics and comfort for the patient, it probably isn't as effective as going back to that first premolar. On the opposing side, I chose the ring clasp on number 31 because the biggest undercut was on the mesiolingual, and it would require more tooth to be reduced in order to place a direct retainer, the typical direct retainer going from the mesial to the distal. I do not have to remove as much tooth when I approach the mesiolingual undercut from the distal area. I also chose the lingual surface of tooth number 29 for a mesiolingual retentive arm. Again, I had to dip down on the lingual with my major connector to be able to place an arm on the mesiolingual. I also had to place the distal incisal angle rest on the distal of the canine to provide support for the two incisor replacements near the edentulous area. The picture above also shows a third option, which is to place the direct retainer on canine number 27. This is acceptable, but I would rather stay a little more posterior on number 29 and that would be more aesthetic and would still be successful from allowing the anterior area from lifting when eating sticky foods in the anterior. I would be placing, if I did go through number 27, I would be placing an embrasure rest, because whenever the metal crosses between two teeth, you would have to have an embrasure type of clasp in order to keep that feeling of wedging of metal between the two teeth. So there would be a mesial-occlusal rest on number 28 and a disto-incisal angle rest on 27. Rests need to be next to each edentulous area or very near them. Therefore, you need one rest on number 22 and 27 definitely in order to provide support for the replacement teeth in the area of number 24 and 25. A rest also needs to be placed next to or on the teeth of those other edentulous areas in the arch. Each clasp assembly has to have a rest, a direct retainer, reciprocal component, and usually a guide plate or a minor connector going up into that area. So all of those things should be looked for when you're choosing your rests. When drawing the major connector, the lower border of that major connector should go to about 1 millimeter above the depth of the floor of the mouth, to be less noticeable to the patient's tongue. That border or that depth has to be determined by measuring the patient's mouth, not by looking at an alginate impression, because the impression usually overextends the floor of the mouth. The superior border of the major connector never will be resting on the gingiva at the cervical part of the tooth. It is usually on the tooth as plating in the middle third, or you drop down behind the tooth and avoid the marginal gingiva by 3 or 4 millimeters on the mandible and 5 or 6 on the maxilla. The solid part of the metal of the major connector between the superior and inferior border of the mandible major connector must be a minimum of 4 to 5 millimeters. It can be wider, but it has to be a minimum of 4 to 5 millimeters. Here's another view of the major connector. When it is on the anterior teeth, it must cover the cingulum of the teeth, and it scallops from contact point to contact point so as to close that small little triangular space that would exist if you did not carry it up to the contact points. This area would be subject to packing food down in it. There are also rules as far as placement. You do not want to place that superior border along the gingival margin, as it will pack food down into the sulcus and the tissue may be stripped away in that area. There are two ways to handle the major connector on the posterior area, designated by the major connector right in front of number 31. This side shows carrying the major connector back to the beginning of the mesial of the molar. See that arrow? This angle should be rounded so as to not give the tongue any type of sharp feeling when the floor of the mouth or when the tongue is brought forward. If that's a right angle and a point, it would be most uncomfortable. Sometimes we wish to stop the major connector at the anterior abutment and use base attachment in the area where we're replacing a tooth, as in this case with number 30. This solution will result, though, in a bulkier feel to your partial because it will be thicker in the area of the base attachment. There's going to be mesh work in that area, and there's a space under it that has to have plastic to go under it and on top of it, so it will feel bulkier. This is done, though, when tooth number 31 is a questionable tooth and may be lost in the near future. When the tooth is lost, then a reline can be done to your denture using that base attachment that's already present for retention, and the base can be extended to cover the retromolar pad and to add another additional tooth in that area. This is not possible when the major connector is carried posteriorly, as in the previous slide, number 23. Here are a couple of samples of frameworks and partials. The partial on the left upper picture shows how the major connector was extended posteriorly. The advantage of this is that it will be thinner on the lingual than if we do it as is being done on the right. On the right, we've added base attachment, and that base attachment has a space under it for plastic to flow and lock the tooth in place. And because it will have the thickness of the metal there, and on that metal on top of it will be another layer of plastic, you would have a more bulky feel to that posterior extent where those teeth are being placed than you would if you used the upper design as we talked about earlier. This slide shows you two replacement mechanisms. The upper one has tube teeth in the posterior area, and the lower one shows you some base attachment and what it would look like. The advantage of the base attachment is that it can be relined, whereas the tube teeth will not have that option. The facing also cannot be relined that is used in the anterior on this mandibular arch. On this design, we have used two areas where base attachment and teeth will be placed, one in the posterior and one in the anterior. The one on the posterior, again, is done because we might need to put a replacement tooth later on down the road when number 31 is lost. In the anterior area, the advantage would be that on the mandible, that little sharp ridge sometimes resorbs rather rapidly, and it could be relined, whereas the facing will not be able to be relined. Let's talk about interferences again, because some of you I don't think quite have it here. Anywhere on the drawing that you have drawn your design below a survey line, you're going to have to indicate an adjustment for that interference in green. That is, every single place where you go below the survey line except one. And what is that one place? You cannot alter, or you want the terminal 1/3 of direct retainers to be under the survey line. You do not want to adjust the terminal 1/3 of the direct retainers. In this particular slide, you can see that on molar number 31, the first half to 2/3 of that clasp was all under the survey line. Therefore, you would have to alter it and show that you're going to remove or move the survey line from that upper part of our circle down to, and you put the bottom of the circle below your red direct retainer. It says you're moving it from the top line down to the bottom line. On the bottom picture, on tooth number 29, again, the first half to 2/3 of your direct retainer arm has been drawn under your survey line. So you must place a circle, and the top of the circle is right above your survey line, and the bottom of the circle is right below where you've drawn the red line, and that says to you, you have to move that survey line from the upper part of the circle to the bottom line of the circle. That's also true on tooth number 31. The same thing, when you started that direct retainer, it's a lot of it is under the survey line, and you have to indicate anywhere on the cast when you have that situation. The other thing that you have is on every interproximal on the marginal ridge area, if the survey line is right at the marginal ridge, you would like that metal to touch a 2 millimeter area on the side of that tooth. So if your survey line is up at the marginal ridge, you want to indicate that you want to move it down a minimum of 2 millimeters so that the metal can guide the partial denture into place, and it has to touch the tooth in order to guide it. If the survey line's at the top of that marginal ridge, it's undercut from there below, so there's no way that it could touch that. So look at every interproximal area, and you can see some green ones even on those anterior teeth, where we have to alter those little guiding planes in order to put a plate there that touches the tooth. Here are two ways that you can draw base attachment on a cast. The top has the external finish line at the crown down the distal lingual line angle and goes to the functional floor of the mouth. The base attachment then starts 2 millimeters above the bottom of the major connector and is drawn as shown on the cast. This is sometimes used when the posterior molar does not have a good prognosis. Then, when the molar is lost, the base can be added on posteriorly on that base attachment and causes quite a nice, easy repair of the partial denture. This side of the cast shows this a little bit better as far as guide plate interference. Every single area that has a guide plate, you very likely will have to do some type of modification in those areas. Not always, but very, very commonly. If on the marginal ridge your survey line is right there up at the top of that marginal ridge, that means that from there on down it's an undercut. And you want the metal in the guiding plane area to be able to touch the tooth along the side of it a minimum of 2 to 3 millimeters along that back side. So if your marginal ridge is where the survey line is, right at the top, you're going to have to circle and show that you're going to move that survey line from right at the marginal ridge level down about 2 to 3 millimeters in order to have that metal touch and guide that partial into position by sliding along that tooth. It can't go into an undercut area. The following slides show how various options could have been used. There were several options that were desirable. How you did on the cast may depend on some other factors, such as 1. The selection of the best clasp design in an area would influence the grade. If it worked, it was going to get at least an average grade. It would not get a minus unless you left one off or totally blew it the way you drew one. More importantly was how you drew all of that design and demonstrated that you understood the rules for the Kennedy Class 3. Clasp must be well drawn with interferences clearly marked, or you get graded down in 2 different areas. Did you demonstrate a knowledge of how to handle and recognize interferences? All of the areas where you drew design under a survey line had to be shown as far as markings with circles to show that you have to go back to that patient and adjust the tooth in that area before you begin your final design. Some of your designs were very faint and very hard to read. Your lines were all difficult and crossing each other and very messy in some cases. So I'm going to be getting a little more strict on this as we go along. Now you'll notice that some of these drawings, the lines are very distinct. They are drawn with a pencil that is easy to read, not some of those little tiny mechanical ones where you have this faint red line all intertwined amongst one another. So please try to make your designs more definitive. Rest must be placed next to all of the edentulous areas or very near them. I included this picture because, again, it's a different option that you can use where you clasp the canines and the posterior molars. But also, it's a very neat design, well defined, and there's no question about whether or not you understand, say, interferences in this particular design, or that you understand the placement of clasp, how clasp are supposed to be drawn. And this is real important. You're in training basically to go into the clinic and bring these designs in and make good diagnoses and plans before you start doing your restorations. So try to develop good habits in this particular class. Thank you. Lastly, here are 4 casts with various design possibilities. You could mix and match some of these and take one aspect on one cast and put it on another cast. But here are 4 different ones that you can look at as possible options when you have this type of configuration of teeth. Lastly, here are 4 casts with various design possibilities. You could mix and match some of these and take one aspect on one cast and put it on another cast. But here are 4 different ones that you can look at as possible options when you have this type of configuration of teeth. You guys have a great day. This has been a review of one of the casts for the Kennedy Class 3. If you did not do well on the exam, then you might want to review the survey and design seminars on YouTube that are related to the Kennedy Class 3, if you have not already done so. A list of the video links is included on the next slide for the Kennedy Class 3. Also, drawing sheets have been included.